Welcome back. You're listening to Dr. Margaret Ames and your dental health. We were talking in the beginning of the show about x-rays. So you can reach me in my office at 631-26145. I have to mention that. X-rays are very little radiation. And the amount of radiation that's actually generated by x-rays and the ability to find decay early is pretty profound. If you wait until you need a root canal, the tooth hurts and you need a root canal, and then you're going to end up with a lot more x-rays than the one that you might have gotten to detect decay early. So my shtick is minimally invasive biomimetic dentistry. Biomimetic means mimicking life. So the result of biomimetic dentistry is no mercury in your mouth, no tooth sensitivity. Your mouth is more aesthetically pleasing, and your overall tooth anatomy is more like what the body expects. And over the lifetime of a single tooth, you can save thousands of dollars. That's why it's becoming the sought-after treatment of choice among informed patients. I want to tell you about Valentine, one of my patients who came in. Her dentist moved to Florida, and she found me through a friend, and she had a periodontist already, was treating her for her bone loss. And of course, I always communicate with the specialists that the patients see. And he had advised her to have a few teeth out so that, and he would put in some implants because that would be more predictable for her. But she said after the economy kind of crashed, she said, is there anything you can do to help me keep the teeth that I do have? So actually, I do a limited amount of orthodontic treatment, and I was able to move her teeth so that she wasn't banging into them. It didn't take long. She still has them. This is 6 years later. She has not had any more implants than the one that she had before she met me. Her teeth look great. She's happy, and she saved a lot of money. So I want you to have healthy teeth, but what people want is healthy looking teeth, and they kind of go hand in hand. Nowadays, when I was in dental school, we said nobody gets the lightest shade. Like B1 is the lightest shade. And nobody gets that because it makes you look like you have dentures. Nowadays, everybody wants B1, and that's become the norm. So if you drink coffee or colas, any dark sodas, even if you drink red wine, those kind of things stain your teeth. Now, you can reverse the coloration. It doesn't have to hurt. We can make you trays, and you put them on your teeth, and you only have to wear them for a few hours a night. And almost everybody, there's a few stubborn stains, like from tetracycline stain. If you took it, if you're in your 50s, then you might have tetracycline stain. And back in the day, they thought that bleach couldn't bleach that out. It does make it lighter. You can also take good care of your teeth by brushing them after you eat and not sipping on the coffee and sipping on the colas all day. Drink it, enjoy it, swallow it. Don't have it linger in your mouth for a long time. Also, you need to come in for regular cleanings because in that way we can remove the stain before it really gets set into your tooth. So regular cleanings also, we find the areas of inflammation, find the areas that you're not brushing well or flossing well. And if you can't floss, we'll find another way for you to get in between your teeth. Flossing is the gold standard. However, a lot of people can't do it. And as I mentioned before, my patient Richard said he wants a bumper sticker that says flossing is an inhuman act. And he was in today, and I said, Richard, I talked about you on the radio. So I want to tell you a little bit about periodontal disease, because when you come in to see the hygienist, she will examine your mouth and find troubled areas where you're not cleaning well. Also take away the areas that have the plaque becomes calcified. If you don't disrupt it every 24 hours, those bacteria form a colony. They have a party in there. They produce a lot of acid, which causes breakdown of the collagen that attaches the gum to your teeth. How do we find this out? Well, there's a little dipstick, and we measure the spaces underneath your gums. And most people can clean up to about 3 millimeters. That's normal. 0 to 3 is normal. So when you come in for the hygienist, she'll spot probe your teeth. But when you come in for your new patient exam, I examine every single tooth and see if there's any bony breakdown. So the probing is usually 3, 2, 3, numbers like that. It's really thorough. I also examine for mobility. So if you have any teeth that are mobile, I want to find out about that. I want to see why they're crashing into each other. See, the teeth are supposed to fit like gears together. When we're asleep, we move our bottom teeth around and see what hits in. Now, we do this in our sleep. This is subconscious because you have to do that as a baby. When you're a baby, you have baby teeth. The teeth, your bone grows at different rates. So your teeth would bump into each other. The gears would hit. And the children have softer teeth, and they're able to grind down the high spots. Adults can't do that. We can't really grind down the high spots. We try, but the weakest link in your system will suffer. That could cause TMJ pain because your muscles could be the weakest link. It could cause bone loss because the bone could be your weakest link. It could cause you to fracture teeth. Sometimes it's a combination where you have bone loss and a cracked tooth. So you want to be examined and have all the bone levels measured. It doesn't hurt. It's very comfortable. I tell patients on their first visit, if this is uncomfortable, I don't have to finish this part of the exam today. So that's what the experience is like in our office. Now, I want to tell you about this magical stuff that I put inside your biomimetic restoration. It's a ribbon. It's a piece of a very high molecular weight polyethylene fiber. Now, do you care what that is? Probably not. But inserting that inside within the filling, embedding it in the filling, is probably the most important thing that will happen to your tooth when you're having it restored. A really brilliant researcher in Turkey discovered this. She did lots of testing. She has a chewing machine so she can see how the extracted teeth respond and how they stay connected to the filling when this ribbon-like material is put in there. It's really unbelievable. So if you earthquake your tooth and something gives, that ribbon is going to stay within your tooth. It's going to allow the filling to flex. And if you break anything and there is a little bit of separation from the filling to the tooth, the bacteria may be able to get in there, but the bonding layer attached to your tooth itself will stay attached, and the germs therefore can't do any damage. You're not going to come in and say, oh, I'm sensitive to hot and cold, something's wrong with this tooth. You might break something, but that can easily be restored. You don't need a whole new crown. That part of the restoration can easily be repaired. It's quite predictable and very successful. So that's something for you to look forward to when you have biomimetic dentistry. So if you've just tuned in, you're listening to Dr. Margaret Ames. The show is Your Dental Health. I can be reached in my office at 631-261-4525. I'm located in the town of Huntington. My website is www.drames.com. So I'll take another question now. Let's see. What is an abscess? An abscess is actually when the nerve inside your tooth dies. And there's no way for the stuff that's inside the tooth to come out. So when the nerve dies, there's bacteria in there. The bacteria eat what's inside there, and they produce pus. Pus is a mixture of your white blood cells that, I shouldn't talk about this gory stuff, but it's really true. And an abscess is when all that stuff can't get out the top of your tooth, so it goes down on a bottom tooth and tries to get out the bottom of the root. And that will cause pain. It'll cause pain to biting. It'll cause pain to tapping on the tooth. And the only way to cure it is to get rid of the pus, and that's a root canal. So if you have a hole in your bone at the tip of the root, that's an abscess. Some people say, oh, I need an antibiotic. Can you give me an antibiotic? But as in the case of any infection, you have to get rid of the cause of the problem. So giving you an antibiotic might get you through a tough time, but an abscess will never, ever heal itself. The tooth has to be treated. So don't wait. Don't think this might get better if I just don't tell my dentist. As soon as you feel some symptoms, call me. We'll get you in on an emergency basis. One of my patients said recently, Jerry, he said, I can't believe it that half an hour ago I had this pain and I called and Marion said, come right over, and you got me in. I mean, he said, I shouldn't tell people that because it's going to make Marion's job harder. But that's what we do because we're there to help you. So let's see. Let me find another question. What do you mean by the rigid and flexible portions of your teeth? Aren't teeth solid? Teeth are not solid. They're not like stone. The inside of the tooth is softer and has an elastic component to it. It's measurable. It's called the modulus of elasticity. So when I restore your tooth, putting that fiber inside and using a special kind of composite resin that has the very similar flexibility to your tooth enables me to restore the inside of the tooth a lot like it was before you got it damaged by the decay. The outside of the tooth is much harder, so I use a different material out there. So the flexible portions of your tooth is what most of the tooth is made up of, because we grind our teeth, we clench, we eat, and that needs to be flexible. So listen to me next week. I'm happy to be here. I'm happy to see you as a patient. Again, thank you to all those people who have responded so well to the biomimetic message. I look forward to hearing from you. You can reach me in my office at 631-261-4525. That's 631-261-4525. Or on my website, which is drames.com. You can email me that way. You can look at the archived past shows that I've done on linewsradio.com. So thank you for listening in, and have a great weekend.